Every year, thousands of children and their families come to WRHN seeking care. And today, we're going to be speaking with Dr. Carolyn Hutzal, our Department Chief of Pediatrics, about what WRHN can do. In fact, over 56,000 people had visits last year. Mm-hmm. So it's a very active program at WRHN, and I'm very pleased to welcome you to Inside WRHN, our latest edition.
Thank you for having me.
Great. So can you just talk a little bit about what you do as the Department Chief of Pediatrics at WRHN?
I'm a pediatrician, so I practice pediatrics like my colleagues, and that means working from childbirth at NICU to inpatient and emergency room care. And we have a very busy outpatient care, and I also have a practice in the community, and I just provide leadership to the department and help with new programs that we're trying to develop and expand on.
So you mentioned a few of the programs that are delivered at WRHN. Could you maybe elaborate on the full scope of the program?
Yeah, we really care for children from birth until adolescence, and that means some of our patients weigh a kilogram and some of them are adult size. And so that's really a challenge within our practice and the patients that we care for is just the diversity. But it really starts with care when children are born, and some are born healthy, thankfully, and some are needing our care. They're premature, they're unwell. So our neonatal intensive care unit is quite a busy place where we help many children get a great start on life. And as we continue on, we have inpatient and care, which provides medical care and post-operative surgical care to children. We have a busy inpatient mental health ward as well for children. And about 70% of our annual visits are outpatient focused. And so that is always a big concentration of the care we give in pediatrics, mainly because kids are home with their families and that's where we want them to be. So we're really trying to have a focus on bringing more subspecialty care to the region for pediatrics. Otherwise, parents were having to travel to the tertiary care hospitals to get the specialist visits that we're hoping to start to provide more of locally.
What would you describe pediatric care at a hospital would be compared to adult care?
Yeah, really, our focus is on family-centered care, and I think that's so important and in some ways unique to pediatrics. Parents really are the ones that know their child the best, know how to care for them, but they need education, they need support, and they need to feel comfortable and have the ability to stay with their child. And so no matter whether we're caring for newborns or teenagers, I think being able to focus on the family as a unit. We have really great pediatric trained nurses, and also we have a lot of allied health staff like child life specialists and social workers and dietitians and all that really help to meet all of the different needs of the child while they're having care in the hospital.
Maybe if you just share a little bit about how you make it comfortable for families when they're having that inpatient experience in particular.
Yeah, it can be challenging because being hospitalized for children is very anxiety provoking, but they often can't talk and they can't tell us what they're worried about. And so we have to be very sensitive to those fears, and also for parents not knowing what's going to happen. Also kind of having to put a pause on your life to be able to come to the hospital and care for your child. So we really want to support them through that and make it the most positive experience we can while their child's receiving care. So that really takes a large team and being creative and trying to meet the child at every sort of developmental stage of life. Caring for a teenager in hospital is very different than a newborn, and when they're starting off and parents are nervous and not sure how to care for their baby. So
I understand that this past year we had over 4,500 births compared, and that's I understand about 500 more than the previous year.
Yeah, our region's really growing.
Yeah, what does that mean? What does it tell us about the need in the community for what we deliver at WRHN?
Mm-hmm. I think we know that a lot of young families are coming to the region and they're having families, and so we're experiencing this exponential growth of newborn care that's needed. And so I think that's really been a focus, and being able to continue to meet that need, which is always a challenge. And I think that many of the areas that we've received donations from the foundation have really helped us to do that.
And I understand that sort of 1 in 4, so about 1,200 of those newborns were needing a stay in our neonatal intensive care unit.
Yeah.
So can you talk about the growth in that particular service?
Mm-hmm. I mean, no one ever plans to be in the NICU, and it's always a surprise and shock, and parents need a lot of support through that, and they need empowerment to feel that they can care for their child and be ready to take them home when they've been sick or born premature. So it really takes a whole team to take care of a child who's born early or unwell. From pharmacists, dietitians, we have a milk tech, and we have a donor breast milk program, and just teaching parents how to feed their babies. All of this is so integral to getting them ready to go home.
Where do you see the pediatric program growing in the future?
I mean, we're excited to think of the care and the programs and the way it's going to be able to expand once we have our new hospital, but we're growing now, and space is getting very tight in our NICU, and so even having a little bit more space to be able to make sure families are feeling comfortable and having the extra equipment that we need would be really important to being able to make sure that in the next 10 years we're able to provide that neonatal care for babies.
And when the new hospital opens in hopefully 8 years, what does it represent for the program? Is there going to be new levels of care? Is there going to be more capacity?
Yeah. We really do hope to be able to provide a higher level of neonatal care. We're looking at almost doubling the size of our NICU. And also, the rooms will really be focused on allowing parents to stay with their babies and provide that care and be with them, which is something that we just can't do in the space that we have now. So that is really exciting in terms of promoting that family-centered care and having different spaces in the NICU where they can stay overnight and feel welcomed in that space, like for as long as their children are there.
And is there other aspects of our inpatient and outpatient programming that will improve?
I think that we want to create more spaces that are child-friendly. And so that's something that we're looking at with the new build as well. Yeah.
Tremendous. It'd be great to be able to offer more to the community so that people don't have to travel down the road to get care. They can do that closer to home.
Yeah.
Be fantastic.
We're really excited that we've been able to build over the last few years a pediatric cardiology program here and welcome some new cardiologists to our area. We never were able to even do a pediatric echocardiogram in our city. And through donations, we're actually just recently able to purchase a dedicated echocardiogram machine for children, for babies in our NICU, and even for older children to be able to receive cardiac care in a region which we've never been able to do before. So we're really excited about that.
Can you share a little bit about some of the specialized equipment that a pediatrics program and NICU would need?
Mm-hmm. Because we treat children and babies of all different sizes, we need all different types of equipment, and that equipment does age out and the technology changes, and we really want to keep everything up to date and be able to provide the best care. So in our neonatal unit, we need warmers that are able to monitor a baby and keep them warm and keep them stable. And that technology has come a long way in the last 10 years. And so we need to upgrade some of that equipment. Ventilators are used heavily in our NICU, incubators, phototherapy lights for jaundice, apparatuses for feeding babies and that sort of thing. That's all equipment that it's heavily used. It does wear down and needs to be replaced and updated.
So why is donor support important to your program?
Yeah, I think investing in children and their health in our region really is investing in the next generation. And so I think that the donations that are given now really will carry forward and help with improving the health of our overall community. And it's not just about treating children's illness, but also supporting them developmentally. So for instance, in our neonatal program, ensuring that children are able to see physiotherapists and have their development tracked and making sure that they receive the care they need to be able to learn and grow well. Treating children's mental health is so important. And so we're really trying to focus our care in that so that we know that children will be able to thrive and grow and be out there in the community.
Has there been any challenges in recruiting staff to the program?
We have our residency program, and so we are bringing new doctors to our region and training them here. And we really find that once they kind of experience the medicine that we practice here, they're often very attracted to stay. It's very busy work. We're up all night, and babies are born at all hours of the night, and children get sick and they're in emerge all hours of the night. But it's also very rewarding work, and so I think they also see that we provide a great quality of care, and we have high standards of care and training. But it's also very rewarding to work and care for individuals in your own community that you see when you're out, and you know that they're doing well after you've cared for them.
And so when donors make a choice to support our WRHN Kids program, what's its impact? Why would they do it? What would you want them to know?
Mm-hmm. I think when you consider the stress and unknowns that families are experiencing in that time when their child is sick, just having a program that has all of the individuals that can help them, the equipment, the spaces that make them feel comfortable, really makes them feel that they had good care, that someone cared about them, that they were able to have the best care for their child. But that really takes the whole community coming together and supporting them. And so I think that when they're aware of the donations and how they've helped, I think that goes a long way to feeling that they're not alone in that healthcare journey that they're going through with their kids.
Every child in Waterloo Region deserves access to care and closer to home. And we're very pleased with the support that our donors have provided to support our WRHN Kids program, the care at and targeting our youngest patients all the way up to when they graduate into the adult system. It's making a tremendous difference, and I hear that every day that I speak with grateful patients and their families. So thank you for joining us for this edition of Inside WRHN and featuring our pediatric care at WRHN. For more information, please visit our website at WRHNF.ca. Thank you very much.